It might surprise you, but the humble egg, long considered a nutritional powerhouse, can actually become a hidden threat to your health if you're not careful, especially for older adults. Many seniors in the U.S. include eggs in their daily meals, believing them to be a perfect source of protein, vitamins, and healthy fats. But what if the way you're cooking, storing, or even choosing your eggs is quietly contributing to chronic health issues? This isn't fear-mongering, it's a wake-up call. One such story comes from Harold, a 74-year-old retired postal worker from Iowa who loves starting his mornings with 2 sunny-side-up eggs and a slice of toast. He thought it was a healthy habit, until his cardiologist warned him about spiking cholesterol and inflammation markers issues directly linked to how he'd been preparing his eggs for years. Like Harold, millions of older Americans could be unknowingly sabotaging their health by making a few common but overlooked mistakes with eggs. The truth is, while eggs offer many benefits, the way they're handled and cooked can either support healthy aging or silently contribute to digestive problems, heart disease, and even foodborne illnesses. Let's talk about storage first. Eggs that are not refrigerated properly, especially in homes where the refrigerator temperature is inconsistent or too high, can become breeding grounds for bacteria like Salmonella. This bacterium is particularly dangerous for older adults whose immune systems are naturally weaker. What's more, many seniors use the float test to check for freshness, a method where eggs are placed in water to see if they sink or float. But this folk technique isn't foolproof. A floating egg doesn't always mean it's spoiled, and a sinking one doesn't guarantee safety either. Properly checking expiration dates and storing eggs at or below 40 degrees Fahrenheit is essential. Yet, many people store their eggs in the door of the fridge, which is the warmest part due to frequent opening and closing. This seemingly small detail can significantly increase the risk of bacterial contamination, especially for seniors with compromised immunity or underlying health conditions like diabetes or kidney disease. Then there's the issue of undercooking. For many older Americans, nostalgic comfort food includes soft-boiled or runny eggs. But undercooked yolks can pose a serious risk. According to the CDC, thousands of cases of foodborne illnesses each year are linked to eggs, many of which affect people over 65. Mild food poisoning in a younger adult might just cause discomfort, but in seniors it can lead to severe dehydration, hospitalization, and worse. Take the case of Margaret, a 69-year-old former teacher from North Carolina. After eating homemade Caesar dressing with raw egg yolk, she ended up in the ER with intense gastrointestinal distress. Her story is not uncommon. Cooking eggs thoroughly until both the white and yolk are firm is a small step that could prevent a major health crisis. Another mistake lies in overconsumption. Eggs are good for you. Yes, but like anything else, too much of a good thing can backfire. Older adults often increase their egg intake to meet protein requirements, but fail to account for the cholesterol load. While recent studies suggest dietary cholesterol may not be as harmful as once thought, for seniors with pre-existing heart disease or high LDL levels, daily intake of 2 or more eggs could exacerbate their condition. It's important to balance eggs with other sources of lean protein like fish, legumes, or tofu. Relying too heavily on eggs, especially when paired with processed meats like bacon or sausage, adds saturated fat and sodium, which can raise blood pressure and strain the heart. This is particularly risky for older adults who are already on medication for hypertension or cholesterol. The type of egg you choose also matters. Many people don't realize that not all eggs are created equal. Conventional eggs often come from hens that are fed antibiotics and GMO-laced feed. Over time, repeated consumption of such eggs can contribute to antibiotic resistance, a Silent but growing concern among seniors who may already be taking multiple medications. Switching to pasture-raised, organic eggs may offer better nutritional profiles with higher omega-3 content and fewer contaminants. Yet many elderly consumers are unaware of the labels or get misled by marketing terms like cage-free or natural, which don't necessarily reflect superior quality or safety. Understanding the difference can help older adults make smarter choices that support heart and brain health. We also need to address how eggs are cooked. Frying eggs in butter or margarine, especially for those with high cholesterol or heart conditions, can be damaging. The method adds unhealthy fats and increases calorie content, which may contribute to weight gain, joint pain, and higher triglycerides. Seniors who experience inflammation-related conditions such as arthritis may find their symptoms worsen with frequent intake of eggs. Fried and saturated fats. Opting for poached, boiled, or dry scrambled eggs using a nonstick pan or heart-healthy oil like olive oil is a better alternative. Yet the traditional American breakfast still favors heavily fried and salted preparations out of habit, convenience, or simply taste. Making small swaps here can go a long way in preserving vitality and longevity. Let's not forget about those with undiagnosed egg sensitivities. As the body ages, digestion changes, and some people develop intolerance to certain proteins, including those found in eggs. Symptoms such as bloating, cramps, or irregular bowel movements are often misattributed to just getting older, when in fact they may be related to an egg sensitivity. Moreover, repeated exposure to allergens over time can increase inflammation in the body. Seniors dealing with autoimmune conditions or chronic fatigue might benefit from an elimination trial under medical guidance to see if reducing or removing eggs from their diet leads to improvements in energy or gastrointestinal comfort. Another silent mistake involves cross-contamination in the kitchen. Seniors who live alone or are cooking less often may not realize how easy it is for raw egg to spread on countertops, utensils, or dishcloths. Using the same cutting board for raw eggs and vegetables without proper sanitizing can introduce harmful bacteria into a healthy dish. Older adults who may have visual or mobility impairments might miss small spills or drops, further increasing the risk of foodborne illness. Educating caregivers and older individuals about these hidden hazards can dramatically reduce the risk of infection. Additionally, some medications that seniors commonly take can interact with dietary cholesterol or protein intake. For example, statins prescribed for cholesterol control may be affected by high cholesterol meals, and excessive protein can interfere with medications for kidney or liver conditions. This is why seniors should always consult their physician or a registered dietitian about the right amount and form of eggs suitable for their specific health profile. There's no one-size-fits-all recommendation, especially when it comes to aging bodies that metabolize nutrients differently than younger adults. All of this is not to say eggs are bad. On the contrary, eggs provide essential nutrients like choline, which supports brain function, and lutein and zeaxanthin, which are important for eye health issues, especially important to those over 60. But it's the preparation, portion, pairing, and storage practices that make all the difference. Making small changes like switching to hard-boiled eggs stored properly, balancing intake with fiber-rich vegetables, or choosing organic over conventional can drastically improve the way older adults benefit from this common food. If you've made it this far, you might be realizing just how many small, seemingly harmless decisions around eggs can add up to big health consequences. Many older adults believe they're making healthy choices simply by including eggs in their diet, but unless they're intentional about how they handle, cook, and consume them, they could be exposing themselves to more harm than good. Next time you crack open an egg, think about the oil you're using. the temperature of your fridge, or whether your immune system could handle a runny yolk. These aren't just details, they're decisions that impact your quality of life, your mobility, and your independence as you age. If you or someone you care for is over 60, now's the time to reevaluate how this staple fits into your dietary habits. Your body, especially with the changes that come in later life, deserves thoughtful, informed choices that protect rather than jeopardize your health. Eggs can remain on the menu, but only if you're mindful of these crucial mistakes. It's essential to take a deeper look into the broader dietary context in which eggs are consumed by seniors. A large number of older adults incorporate eggs as a convenient protein source, especially during breakfast. However, what surrounds the egg on that plate often matters just as much. If eggs are accompanied by white toast, sugary jam, processed meats, or high-sodium cheeses, the overall nutritional value of the meal declines significantly. This combination of refined carbs, sodium, and unhealthy fats can trigger blood sugar spikes, elevate blood pressure, and cause insulin resistance, all of which are particularly concerning for seniors managing type 2 diabetes, metabolic syndrome, or cardiovascular disease. Doris, a 76-year-old widow in Colorado, followed what she thought was a heart-healthy breakfast, eggs with turkey bacon, toast, and fruit juice. After a mild stroke, a nutritionist reviewed her daily meals and found that despite the eggs being well cooked and lean, the hidden sugars and sodium in the rest of her breakfast were aggravating her vascular health. Her story illustrates how a healthy food can lose its value if consumed in the wrong context. Another problem lies in repetition and dietary monotony. Many elderly individuals eat eggs daily out of habit, simplicity, or budget constraints. While eggs are cost-effective and easy to prepare, relying too heavily on one type of protein can lead to nutritional imbalances and a lack of dietary variety. Over time, this monotony can lead to deficiencies in other vital nutrients like fiber, magnesium, and antioxidants, nutrients found in plant-based foods that are often neglected. Seniors on fixed incomes or with limited access to fresh groceries might default to eggs because they're shelf-stable and familiar. But without incorporating a wider variety of foods like leafy greens, beans, berries, and whole grains, they may be increasing their long-term health risks. Portion control is another frequently overlooked issue. Many people assume that because eggs are relatively small and low in calories, they can be eaten in large quantities without consequence. But for older adults, digestion slows and metabolism changes, making it harder for the body to process excess protein and fat. Consuming too many eggs per day, especially if unbalanced by fiber and hydration, can put strain on the kidneys and digestive tract. This is especially risky for seniors with chronic kidney disease or those at risk of dehydration. In fact, mild dehydration is one of the leading causes of emergency hospital visits among the elderly. Meals that are protein-dense but low in moisture, like scrambled eggs without fruits or vegetables, may further exacerbate the problem. Let's not overlook how cultural habits influence cooking methods. In some American households, eggs are still cooked using traditional cast iron skillets that have been passed down for generations. While charming and often useful, many seniors fail to maintain or season these pans correctly, which can cause food to stick and lead to the use of excessive oil, butter, or sprays. This results in a meal that's far higher in unhealthy fats than intended. Additionally, scratched or worn nonstick pans can leach harmful compounds like PFOA or PFAS into the food, especially when exposed to high heat, posing risks that accumulate over time and may affect liver function, hormone balance, and even increase cancer risk. Seniors with weakened detoxification systems or compromised liver health should be particularly cautious of this hidden threat. We also must consider those seniors with dental issues or swallowing difficulties. Eggs are often considered a soft and easy-to-chew protein for individuals with missing teeth or dentures. While true in general, if the egg whites are overcooked and rubbery, or the yolks are dry and powdery, it can become difficult to chew and swallow. This can lead to choking hazards or reduced food enjoyment, which in turn affects appetite and nutritional intake. Ensuring eggs are cooked to a soft but safe texture, especially in poached or gently scrambled forms, can make a critical difference in both safety and satisfaction for elderly individuals with oral health challenges. Another overlooked issue is egg timing. Many seniors take daily medications for blood pressure, blood thinners, or thyroid conditions. Some of these medications must be taken on an empty stomach or with minimal food interference. Yet many older adults unknowingly disrupt medication absorption by consuming eggs or other high-protein foods too soon after swallowing pills. For example, levothyroxine, a common thyroid medication, can be significantly less effective when taken with breakfast. Eggs, rich in both protein and certain minerals like calcium and iron, may interact with this absorption, causing the medication to work improperly, often without the person realizing it until symptoms worsen. Coordinating medication timing with meals is an under-discussed but crucial part of elder care. Nutrition. Equally concerning is the psychological association many seniors have with eggs. For some, eggs represent stability, tradition, or even identity. Changing a beloved breakfast routine can feel emotionally difficult, especially for those who are grieving, isolated, or experiencing cognitive decline. As a result, some elderly individuals may resist changing their cooking methods or dietary patterns, even if they are shown to be harmful. That's why education and gentle support are vital. Family members, caregivers, and healthcare providers should avoid guilt-tripping or forcing dietary changes, and instead offer alternatives that feel just as comforting, such as egg alternatives made from chickpeas, or heart-healthy avocado toast with poached egg. Some seniors may turn to pre-cooked or processed egg products for convenience. Items like frozen breakfast sandwiches, powdered egg substitutes, or boxed liquid eggs may seem easy, especially for those with arthritis, poor eyesight, or limited mobility. However, many of these processed items contain hidden ingredient sodium, preservatives, stabilizers, and even artificial coloring that can negatively affect heart, kidney, and liver function over time. For example, a ready-made egg sandwich might contain over 900 milligrams of sodium, almost half the daily limit recommended for someone with hypertension. Encouraging older adults to use simple but fresh ingredients whenever possible, or helping them batch cook and safely store meals, can dramatically reduce their dependency on processed egg-based products. And what about eating eggs out at diners or restaurants? Seniors who frequently eat out may assume their eggs are being prepared the same way they would at home. But commercial kitchens often use lower quality oils, pre-mixed eggs, or reheated preparations that degrade nutritional quality. Worse, most kitchens won't cater to specific dietary needs unless asked so, unless a senior is actively requesting their eggs to be cooked with no butter or extra salt. They may be consuming much more fat and sodium than they realize. Encouraging older adults to ask questions, make special requests, or choose simpler menu options can help them eat out safely without sacrificing their health. Finally, let's not underestimate the importance of food safety awareness among elderly individuals living alone. As vision, smell, and memory decline with age, it becomes more difficult to detect spoiled or contaminated eggs. Some seniors may forget how long the eggs have been in the fridge or misread expiration dates. Others may lose their sense of smell and fail to detect the sulfur odor of a bad egg. educating seniors about labeling their cartons, discarding eggs after 4 to 5 weeks, and avoiding cracked or dirty eggs can greatly reduce the risk of illness. Using a Sharpie to write the purchase date on the carton is one small action that can help seniors stay safe and aware in the kitchen. It's clear that while eggs can play a valuable role in senior nutrition, the potential for harm lies in the details: the cooking method, the storage temperature, the pairing foods, the portion size, and even the psychological or habitual context. For aging individuals who already face greater risks of disease and nutritional deficiency, ignoring these factors can transform a healthy ingredient into a silent health hazard. The key is not to eliminate eggs, but to consume them intelligently and adaptively based on one's individual health profile, medications, and lifestyle. When done correctly, eggs can continue to be a source of nourishment, pleasure, and tradition for years to come. As we wrap up this critical discussion, it's important to shift our focus toward empowering older adults with practical strategies to make safer, healthier choices when it comes to eggs. Knowledge without application leads nowhere. So how can seniors and their caregivers take all this insight and turn it into lasting habits that protect health and enhance quality of life? First, it begins with self-awareness. Understanding one's own medical conditions, whether it's heart disease, high cholesterol, diabetes, kidney issues, or food sensitivities, should guide how eggs are included in the diet. No two seniors are the same. What works for one might be risky for another. For instance, a 70-year-old woman with controlled blood sugar and no cardiac history may enjoy eggs more frequently than an 80-year-old man recovering from a stroke. Working closely with a healthcare provider or registered dietitian can help fine-tune recommendations to meet specific nutritional needs, reduce risks, and avoid harmful interactions with medications or underlying conditions. The next step is preparation. Seniors should aim to use cooking methods that retain nutritional value without adding harmful ingredients. Hard boiling, poaching, or lightly scrambling eggs using a nonstick pan and a dash of olive oil are excellent techniques. These approaches reduce added fats while maintaining taste and texture. Microwaving eggs in water can also be a quick, low-fat option for those with limited hand strength or stovetop access. For those with trouble chewing or swallowing, adding a spoonful of plain yogurt or unsweetened applesauce to scrambled eggs during cooking can create a softer, creamier texture that's easier to manage. Seniors should avoid adding processed meats like bacon, ham, or sausage to egg dishes unless they are labeled low sodium and nitrate free. And even then, portion sizes should be carefully controlled. Smart storage is another critical area. Eggs should always be kept in the main body of the refrigerator, never in the door, and at a stable temperature below 40 degrees Fahrenheit, 4 degrees Celsius. Buying eggs from reputable sources with proper refrigeration, checking expiration dates, and discarding any with cracked shells or unpleasant odors can go a long way in reducing foodborne illness risk. Seniors who have trouble remembering how long eggs have been in the fridge can use small stickers or labels to note the date of purchase on the carton. Freezing whole eggs after cracking and beating them can extend their shelf life safely, provided they're kept in airtight containers and used within 3 months. Caregivers play a vital role in making these changes sustainable. Whether it's a family member, home health aide, or senior meal delivery program, those involved in senior nutrition need to be educated on egg safety and health considerations. Teaching them about appropriate portion sizes, gentle cooking methods, and signs of food spoilage can significantly reduce health risks. Even small conversations about switching to organic eggs, limiting processed breakfast items, or reviewing weekly menus can have a major impact. Community centers, senior housing facilities, And retirement homes should also provide clear, senior-friendly nutritional education to support better choices and reduce dependency on processed or unsafe food. Another way to support egg health for seniors is through meal planning. Instead of defaulting to eggs every day for breakfast, alternating them with high-fiber oatmeal, Greek yogurt with fruit, or nut butter on whole grain toast can improve digestive health, reduce inflammation, and diversify the intake of vital nutrients. If eggs are consumed for lunch or dinner, pairing them with vegetables like spinach, tomatoes, or bell peppers can enhance their nutritional value with antioxidants and fiber. These small additions can also help mitigate cholesterol absorption and improve gut function, which becomes increasingly important with age. Seniors with difficulty shopping or cooking can benefit from simple tools like slow cookers, egg cookers, or even air fryers with senior-friendly interfaces. It's also essential to think about hydration. Eggs, being a dry protein, need to be balanced with adequate fluid intake, especially in older adults who may not feel thirst as acutely. Encouraging a glass of water with every meal, along with moist accompaniments like soups, fruits, or smoothies, can support kidney function and digestion. Chronic low-grade dehydration is alarmingly common in seniors and can be worsened by high-protein diets without sufficient fluids. Those managing kidney disease or urinary tract issues should be especially cautious and speak with their doctor about how much water they should consume when eggs or other protein sources are a regular part of their diet. In many ways, changing the way seniors relate to eggs means rethinking the comfort foods and habits they've held for decades. This process isn't always easy. Food is deeply personal, tied to memory, culture, and emotion. That's why the transition should be gradual, respectful, and focused on adding new options rather than taking old favorites away entirely. For example, replacing 2 daily eggs with 1 egg and half a cup of black beans can lower cholesterol, improve fiber intake, and offer a new flavor profile without feeling like a restriction. Cooking classes, recipe swaps among senior groups, or even simple kitchen demonstrations at community centers can make healthy cooking feel social and enjoyable, not isolating or clinical. Ultimately, the goal is not to vilify eggs, but to ensure they are treated with the same caution and care that all perishable animal products deserve, especially when it comes to the elderly. When consumed safely and mindfully, eggs can still offer rich sources of vitamin D, B12, choline, and complete protein that are essential for aging muscles, brain health, and immune strength. But they should be part of a diverse, well-rounded diet and not treated as a one-size-fits-all solution for senior nutrition. Seniors should be encouraged to view eggs as one healthy piece in a much larger nutritional puzzle that includes plant-based foods, hydration, safe cooking practices, and personalized guidance from professionals who understand the nuances of aging health. In closing, eggs can either serve as a valuable ally in healthy aging or become a quiet enemy, slowly undermining health if consumed carelessly. The difference lies in the details: how they're stored, how they're prepared, what they're eaten with, and how often they're consumed. Older adults deserve to make these decisions with full knowledge, dignity, and support. So the next time you or a loved one prepares an egg, don't just crack and fry. Pause, consider, and cook with care. That one small habit could be the difference between a life of vitality and one vulnerable to hidden dangers. Share this message with someone you care about, and take that extra moment to ensure the eggs on your plate are truly serving your health, not silently stealing it.